Welcome viewers. We are having kids in all of our families, almost all families, and we are very much worried about that disease. When they become sick, the parents becomes very much worried. Today, in this video, we shall discuss about the common problems of the babies and their treatment, what to do, what not to do about that. So it is very important. However, I am Dr. J.P. Das, Principal of National Institute of Medical Science and Director of Moshami Hospital. Without killing time, let's start the video. Food and seasonal allergies can be a problem for some kids. Gluten sensitivity and peanuts allergies are on the rise, and they can certainly complicate things on a daily basis. For this type of allergies, a rescue medication such as EpiPen may sometimes be prescribed, though difficult during these times of shortage to get your hands on. Seasonal allergies can also be downer for kids. Behind a typical allergy medications such as children's Benadryl, Claritin, Flonase, or Zyrtec, your pediatrician may also prescribe. Nasonex mometasone is a steroidal nasal spray used to get your children's seasonal congestion, sneezing, and runny nose under control. It is approved for kids over 2 and can also be used as a preventive medicine for seasonal allergy symptoms in children over 12. Shortness of breath, wheezing, and cough after exposure to environment allergies and toxin, cold air, exercise, and even viruses can signify the basic symptoms of asthma in the kids. According to CDC, it is a hard-hitting chronic disease that affects 8.3% of kids in India. Interestingly, 70 to 80% of kids who have asthma also have seasonal allergies. Here is a list of most commonly prescribed asthma medication for kids. Albuterol, salbutamol is a bronchodilator used to relax the airway to increase airflow to the lungs. It is approved for the children over age of 14. Singular montelukast is used to prevent asthma attacks in the children as young as 12 months old. It can also be used to treat symptoms of seasonal allergies in children over the age of 2. Fluticasone is a steroid inhaler used to prevent asthma attacks in children over 4 years old. This medication is not a rescue inhaler and should be used in combination with one. Dulera formoterol mometasone is a combination inhaler containing 2 drugs, formoterol and mometasone. This combination makes a bronchodilator and corticosteroid and is used as a preventive maintenance inhaler for the children over 12. Just like fluticasone, it is also not a rescue inhaler and should be used for conjunction with one. Most parents would not be overly surprised to learn antibiotics top the list most commonly prescribed medicine for the children, that is
the bacterial infections. They treat a host of bacterial infection from strep throat to ear infection, UTIs, and much more. They do not, however, treat viral infection, so your doctor will need to identify the cause of your children's ailments to be sure. Over the past decade, doctors have become more leery about prescribing antibiotics to avoid overdose and antibiotic resistance. Interestingly, a new study published by the British Medical Journal Gut has found a link between antibiotics and antacids given to kids, the child and child obesity, because of the way each of the medication can disrupt gut flora and the way of the body digests and absorbs nutrients. It can lead to weight gain. This is not to say all cases of antibiotic are unavoidable. However, depending on the types of bacterial infection your child has, one of the following may be prescribed. Amoxicillin is a penicillin-based antibiotic used to treat a host of bacterial infection including tonsillitis, bronchitis, gonorrhea, or ear, sinus, skin, and urinary infection in children as young as few months old. Augmentin, amoxicillin, and clavulanate is a combination antibiotic that treats bacterial infection with a dose of penicillin and clavulanate potassium to fight bacteria that is resistant to penicillin or other antibiotic. It can be used to treat sinusitis, ear infections, bronchitis, urinary tract infections, and other infections in children as young as 12 weeks. Azithromycin, fights as a host of infections in children older than 6 years old, such as respiratory, skin, or ear infection, as well as sexually transmitted disease. Cefalexin is another antibiotic that can treat a host of bacterial infection in all children over 1 year old. Bactropan ointment. Mupirocin is an antibiotic ointment used to treat certain bacterial skin infections in children and teens. Cyprodex otic, ciprofloxacin, and dexamethasone is an antibiotic suspension used to treat ear infections. It is a combination antibiotic and steroids, and together they treat the infection as well as bring down inflammation in a child's ear.
Friends, we have come at the end of this video. I hope you have got some knowledge about the different disease of the children's and what to do and what not to do about the diseases. So I think you will be benefited by this. If you have liked the video, please give a like. If you are new in this channel, please subscribe it to get new very informative such medical topics in future. So see you again in the next video. Until then, bye bye.